Hi, my name is Paul Verk. I'm going to be the student NP today, and today we're going to do a PEDS examination on our 6-year-old patient named Josh. So, in the beginning of the exam, you want to kind of be at the patient's eye level, as I am right now. You want to make sure you keep the environment. You want to keep the patient calm. You can allow the patient to sit on the table, as Josh is right now, or you can have the patient sit in the parent's lap. You also want to allow the parent to kind of undress the patient. This allows you to see the relationship between the parent and the child, the child's behavior towards the parent, their temperament. So yes, you want to make sure that the patient is not in any form of distress. So first you want to start out with like just a general survey, kind of talk to the patient, ask them their name, how old they are. Once you've done that, you kind of want to look at the patient when they're sitting down, kind of start seeing, depending on their age, if they have any developmental delays. You want to assess cognitive abilities. You want to assess their ability to develop sentences, their language, make sure they don't have any slurs. Then you want to kind of assess their somatic growth, so their weight and height. Is it good for their age? So we can assume this patient, Josh, weighs about 50 pounds. The height is 44 inches, so they're appropriate for their age. While they're sitting down, you can also assess their vitals. So for a 6-year-old, their heart rate could be around 75 to 110. Respiratory rate 18 to 30. Temperature, you want to usually take it in the ear for a school age to be more exact. Their blood pressure is usually 120 over 80 is the normal for them, school age as well. From there, you kind of want to do the skin first. You want to, since the patient is already undressed, you want to kind of assess the skin, their overall skin color. Is it appropriate for the rest of their body? Is there any hyperpigmentation? You want to assess their fingertips and their toes to make sure there isn't any cyanosis or clubbing at the fingertips. Then you want to check the skin on their face. Make sure there's, obviously, like I said, you want to check the color, their texture, kind of like their hair distribution. So this looks really appropriate. The color is the same. Their hair distribution is good. There's no patchy hairs on the head. Some of the common things you can look at for school-age children could be if a child has birthmarks, a nuvi, impetigo, or ringworms. Looking at this patient, there are no signs of that. Also, you want to make sure there's no signs of abuse or any form of lesions. It doesn't look like it. No forms of abrasions or lesions or any form of signs of abuse. From there, you want to move to, start with the head to toe. So focus on the head. You want to observe the shape of the head, kind of palpate the head. You want to assess for hair distribution. Make sure they don't have any lice. Good. So even hair distribution, no patchy hair. You kind of want to look at the patient's overall face, their eyes. So we can look at the eyes. They're very symmetrical. They have the same distance from the bridge of the nose. Look at the ears. The ears seem to be leveled at the same level. This allows you to kind of rule out some of the common syndromes that you could find in a school-age child. Down syndrome, fetal alcohol syndrome. So you can rule some of that out as well. Then you want to move to the eyes. You want to inspect the cornea. You want to inspect the iris, the lens. You want to check the color of the conjunctiva, the sclera. So that looks pretty normal. You can check for, you could do a strabismus test, so color light reflex. If I use my phone, I can shine a light in the patient's eyes from far away, and I can tell that it's in the center of the eye. There we go. Okay, this rules out any any weaknesses that the patient might have in any of their eye muscles. Also, you can do a cover-uncover test. Good, normal. You can also test the patient's visual acuity. For a school age, you can actually do a Snellen's test. For this patient, it would be 20 out of 20. You can also check for confrontations, check their visual fields. So kind of have the patient cover up one eye, and you cover up the same eye, and kind of bring an object into their visual field to see if the patient recognizes the object or when the patient recognizes the object. So in this test, this patient is able to recognize the test, and they're able to recognize the object coming into the field. You can also have the patient look at objects with different colors to see if the patient recognizes the appropriate color. So if hold up a ball that's red, see if the patient is able to tell you what color that ball is and the shape. You can also shine a light into the patient's eye to check the pupil reaction. Okay, good. Okay, you can also check. You can check the 6 cardinal fields. So you kind of have the patient follow with just their eyes. Good. The next thing you want to assess is the ears. So you kind of want to just check. You want to begin with checking the outer part of the ear. Check the auricle, the color, the positioning of the ears to make sure they're even on both sides. You want to kind of palpate the outer part of the ear, the tragus, the pinna for tenderness, so obviously non-tender. Then you want to take your otoscope and just check into the ear, check the ear canal first. So take the otoscope. When doing this, you want to kind of pull the auricle upwards and pull it back. So pull it up and back and insert the otoscope. You want to assess the ear canal to make sure there is no tenderness, and if there's a little bit of cerumen, that's fine. And then from there, you want to check the color of the TM. You want to make sure there's no bulging. That could indicate that there could be fluid in the back of the TM, or you want to make sure there's no rupturing of the TM. You can also assess the hearing of the patient as well. You can stand behind the patient and close off, plug one ear and say something very quietly like 22 and see if the patient is able to hear it. And then do the same thing, close off one ear and say 0 and see if the patient is able to hear it on the other ear. So this way you know that that patient's auditory system is intact. Next thing is you want to inspect the patient's nose. You want to assess for symmetry. You want to make sure visually when you're doing inspection there's no nasal flaring, no any lesions on the nose. You want to make sure you want to inspect the bridge of the nose, and you want to take a light and inspect each nair separately. Okay. You want to inspect the nairs for any nasal deviation, any polyps. You want to check the nasal mucous membrane. From there, you want to move on to the mouth. First, you inspect the mouth from the outside. You check the lips, the symmetry of the lips. You have the patient smile, puff their cheeks. Then you have the patient open their mouth, stick out their tongue like ah. This allows you to check the tongue, the tonsils, the uvula, to make sure it's midline. And once the patient has kept their mouth open, you're able to assess their gums, the mucous membrane, just to make sure there's no inflammation. You can check the teeth as well to make sure this patient doesn't have any cavities or any plaque. From the mouth, you want to move down to the neck. You kind of want to look at the neck's coloration, Make sure they don't have any signs of enlarged, you know, they don't have enlarged thyroid. You could do that by, you know, palpating the thyroid from the back. They're not supposed to have it should not be palpable. You can also have the patient, you know, do range of motion of the neck to make sure that they are able to turn their neck in all directions. So have them do chin to chest, back. So you can do chin to chest, back. You can have left, right. This allows you to check the range of motion of the neck. You can also check for their lymph nodes by palpation. If the lymph nodes are palpable, it could be a sign that the patient probably had a past infection. Yes. From there, you want to move on to the chest area. You want to first inspect the chest. You want to inspect for any lesions, feel for any bumps. From there, you can auscultate the heart. So we can auscultate the heart. In a school age, the apical pulse can be auscultated at the 4th or 5th intercostal midclavicular space. So you kind of want to go through the whole ape to man. Good. You want to listen for S1, S2 sounds, any murmurs. You want to assess the rate and rhythm. You can, you know, feel their pulse. You can assess their heart rate by feeling on the radials for an entire minute, or you can listen to the apical pulse as well. In school-age children, it's common to have a benign murmur. Sorry. One of the murmurs is a Still's murmur. That's something common. Another thing that you can possibly hear is a venous hum, which should be under the right clavicle area, which is very common as well. After you've done the cardiac assessment, you can assess the patient's lungs, their respiratory. So you can distract the patient before you even start auscultating. You can distract them with a watch or a toy, and kind of just watch and count their respiratory rate for 1 minute. Their inspiratory and expiratory should be 1 to 1. From there, you want to check the lungs. You want to listen for the lungs for any adventation sounds. Check the back as well. Good clear lung sounds, no adventation sounds. Respiratory rate, we can say this patient's respiratory rate is 20. You want to also make sure that the patient isn't using any accessory muscles, because that could indicate some sort of respiratory disorder.